Arthur Ashe was the first African-American to win the men's singles at Wimbledon and the U.S. Open, and the first black American to be ranked #1 in the world. One of his other lasting legacies is the Arthur Ashe Institute for Urban Health, established shortly before his death, with the goal of decreasing health disparities through education, research, and advocacy. In partnership with SUNY Downstate, it serves immigrants and others in need in Brooklyn. With us today is the newly appointed CEO, Dr. Marilyn, Fraser. So nice to meet you, and congratulations.
Thank you so much.
You just got started in August, right?
Yes, just in August after being at the Institute for 16 years.
So what are the top items on your to-do list?
So some of my top items are to make sure that community health empowerment keeps central as our central goal for the Institute, going out and doing community outreach, raising funds for the Institute. Those are my top key things that I would like to do right now.
And we should mention that you've been an insider for a little while.
Yes, I've been
16 years or something?
16 years ago.
Started when you were in high school, right?
Yes, of course. When I was in high school, I started at the Institute. I started as a program coordinator, coordinating some of our outreach efforts. We go out into non-traditional settings, into beauty salons and barbershops, and talk about health and promote health in those venues.
Because it was really important to Mr. Ashe that these folks that might otherwise not have access to information and actual care get that, and that's what the Institute is all about, providing that.
Exactly, and because there are so many social issues that affect health and affect access. So when you think about housing, when you think about income, when you think about education, those are all different things that affect health and affect whether people will access care or not. So Arthur was very much interested in that. He was interested also in the next generation of health professionals, making sure that young people of color had the opportunities to pursue health professions. Also policy, making sure that we inform, that we are aware of policy and inform policies, because sometimes system changes need to be made in order to better health outcomes.
Yeah, you've got to get at what the root issue is.
Exactly, exactly.
Now, you guys, the Institute located in Brooklyn, correct?
Yes.
So who's your target audience?
So our target audience are African-American, Afro-Caribbean, immigrants, people of color within Brooklyn, and within Brooklyn and in various parts of Brooklyn. We are focused in Brooklyn right now, but we would like to replicate our programs elsewhere and hope that we can kind of incubate programs in Brooklyn and implement programs there and then replicate them elsewhere across the country and even internationally.
And look, it's been working.
It's been working.
So it sounds to me like that's probably a good idea to take your success other places. I know that you have a long list of outreach initiatives. Talk to me about some of them. I know that there are some that you really are near and dear to you. Health promotion, talk to me about that one.
Yes, so our health promotion programs, we conduct them, as I mentioned, in non-traditional settings such as beauty salons and barbershops. Currently, we have a program called Barbershop Talk with Brothers, and it's an HIV/AIDS risk reduction program looking at African-American, heterosexual African-American males and reducing risk. We have our program that's Heart of a Woman and looking at cardiovascular disease in women of color. And we train barbers and we train stylists so that they're the health messengers. So we have trained stylists to talk about breast health to their customers. And we have trained barbers to talk about prostate cancer, to talk about HIV and AIDS also to their customers.
And the idea behind these programs, of course, is you are going to where the people are.
Yes.
And talking with them in settings where they feel comfortable already.
Yes, we usually say that most customers, most women may have a hairstylist and may not have a primary care doctor. We go to our hairstylists, men go to barbers and barbershops, and they're comfortable talking to their stylists and their barbers, and they're comfortable just having those conversations, and why not incorporate health in those conversations?
And how do you move the conversation from, you know, finding out the information in that setting to actually doing something about it, or actually, you know, going somewhere to talk, maybe to take it further, to get an exam, or to maybe start thinking about some issue they actually are having now that, you know, now that they've been informed about it? How do you go from that next step?
So a major thing is developing the curriculum that are culturally tailored to the customers. And so customers and stylists and barbers, they inform what we have developed, so they take ownership of it and linking people to services, so that the barbers and stylists would have a conversation with their customers, but then say, okay, this is a place you can go to get screened. Yes. And yeah.
Okay, and I know that there's another one, the Health Science Academy.
Yes, our Health Science Academy is our after-school program, science enrichment program for high school students that are interested in the health professions. We understand that we need to create a pipeline, so it's an after-school program, the high school portion of it, and we have moved earlier in the pipeline to middle schools and 9th grade, so we can have that continuum. And at the Disparity Center, there's a Brooklyn Health Disparity Center I just wanted to mention, and that's a partnership with the Arthur Ashe Institute, SUNY Downstate Medical Center, and the Office of the Brooklyn Borough President. And that's a community, academic, and policy or government partnership that's addressing health disparities in Brooklyn. And the Institute has been the lead in terms of the community engagement portion of that.
And before I let you go, you guys are about to celebrate 24 years. That's a big anniversary.
Yes.
Why has the Institute been so successful over those 24 years, and why has it lasted?
I think the relationships within the community, having a great board that has supported the Institute over the time, the partnerships that we have with SUNY Downstate Medical Center and other academic partners, but our community-based roots and the community-based relationships that we have built over the years, those have been really helpful in sustaining our programs.
And most of your services, they're free of charge.
Yes.
Yes, that's an important thing to point out.
It's important that it is free. Our students that come in the Health Science Academy, it's a free program for them. They don't pay for that.
If you want to take advantage of the services that the Arthur Ashe Institute offers, you can go to arthurasheinstitute.org, and on that webpage you've got more information about some of the programs that you run, how you can get involved, and more importantly, how you can donate also.
Yes.
Thank you so much for being with us this afternoon. Best of luck, and you got to come back and tell us how the first 6 months or 12 years goes.
Yes, when I'm through college.
Okay.
Thank you so much.